We're at the Ebenezer Baptist Church. I'm involved in the church. I sing in the choir. My mother used to play the piano in this church, so it has a lot of sentimental value to me. And I continued to sing in the choir where she was the pianist. I was at a point where I literally could barely walk. It was very, very painful. So I finally went to my doctor and I said, you know, there's something going on here. I wasn't able to do the things I enjoy doing. I like to swim. I wasn't able to swim. I like going to the gym. I wasn't able to go to the gym. And I said to my doctor, you know, enough is enough. We need to figure something out. And she agreed. And so she referred me to Dr. Carlisle.
Diane was interesting because she came to me with knee pain. When I see somebody with knee pain, the first thing that we're always going to check is their hips.
I said, Dr. Carlisle, I think it's my knee. And he said, well, what you described is absolutely correct. The difference is it's not your knee, it's your hip. And he says, I knew it when you first walked in the door. I said, wow, how did you know? He said, by the way you were walking.
She had really bad hip arthritis and I think some avascular necrosis in the hip. And so bad to the point that any one of us that had that may not be able to get out of bed. Pain can be so bad. She's pushing through it. It just was time. She needed something done to help her. So we talked about doing a total hip, and fortunately, she did very, very well with that.
My surgery was a little different because the cut was in front and not in the back. And so the recovery was amazing because I didn't have the restrictions of, you know, you can't bend down, you can't do this, and you can't do that. So in 6 weeks, I was back to work.
You know, I did an extra year of training specifically so I could learn the anterior approach to the hip. And the benefit is that we don't cut through muscle, we don't peel tendons off the bone, we just go between muscle groups. And what I've seen in training and in practice is that patients recover quicker. You know, for Diane, you know, she could get into surgery, come out of surgery, and a lot of times people say that pain that they had when they went into surgery, that's gone when they wake up. And I know that was true for her too.
After my surgery, I went to a meeting and this guy said to me, you look 25 years younger. I'm thinking, that sounds good. It's like I'm a different person.
With any patient, the goal is try to help in some capacity. And a lot of times what I see is patients are in pain. So the goal is to improve your pain in some capacity and try to get you back to doing what you want to be doing.
I'm in no pain. I get up in the morning, I go to the gym. I walk 3 miles on the treadmill. I would lift weights. On Saturdays, I swim. I just feel so much better.
She's like the perfect patient. I think she's a great outcome, a great person, and you know, a great story.
I just want to say this, if anybody is thinking about having a hip replacement, you better go to my doctor, because he knows what he's doing. End of story.